Uh, so do not be concerned about it. All right, we'll continue on psychosocial skills. I hope we'll finish today because I am planning to start with a new part next week, no, by Sunday. All right. Now, as I mentioned to you earlier, in psychosocial skills, we need to have what we call a psychosocial nursing assessment. Now, how do we assess our patient? We have to look into all sides, all facets, particularly in the psychosocial aspect of them. Now, as a nurse, we are taught how to do holistic care. The most negligible part of our, whenever we are going to admit a patient in the hospital, is that sometimes we do not assess anymore their mental health. We do not assess anymore their psychosocial aspects. We only go on what's the obvious because this is what our informatics are telling us. You get it? So this is what they are actually telling us. No, we just fill in our computer and that's it. Sometimes we do not observe. We do not do our interview. Our interview is actually very superficial. That's the problem. So chances are we missed diagnosing their distress, their psychosocial or psychological distress. That is the thing. But we know that in our practice, we know that in our education, the most fundamental one of the most fundamental problem that a patient may encounter would be psychosocial problem. That's why we need to give and we need to provide psychosocial interventions. So that's the thing. So last week I started you with this. We should be more deliberate when we are going to talk with our patients. Sometimes, this is not an indictment on nurses, but when we are going to speak with our patients, we should be a little bit friendly. It's not just a business, no? That's why we don't call only our client as client. We call them as patient because they are really in need of something. We keep on debating what we are going to use in our nomenclature. All over the world, they are using client, but in UAE, we're using patient. You know why? Because when we say patient, they are in need of something. When you say client, they are paying for something so that we'll provide. And that's not what we would like to have in nursing interventions. So we have to consider the holistic health. So that's the key. All right. Now let us try to proceed in terms in our mental status assessment. Okay. So this is the first and foremost consideration that we have to look into. Now, the mental status as examination is used to determine whether or not there are abnormalities in the patient's thinking and reasoning ability, the emotions and as well as the behavior. No. So we have to be more deliberate. We will be using a tool that will help us to identify if the patient is really in distress or not. We have been campaigning about this. Now, it should be incorporated initially in the process of admission already, not only when the patient is inside the hospital, because this is the thing that we are going to address first. Definitely, as I mentioned to you earlier, the patients would be separated from their family. There is already a problem there. The patient will be separated from their job. There will be a problem there. Whether it will be a short time or a long time, nevertheless, they will be separated. So we have to assess. Other than that, another burden is that they're afraid and there will be anxiety. They will encounter anxiety or uncertainty. So we will look into that, no? Because all these things will affect our patients as such. The mental status examination will include the observations on the following categories, no? How are they? How do they appear? Their appearance. Isn't it that these are the things that we have to check first? But when we record, we'll say they appear neat and clean. But we are not supposed to, we have to go deeper, including the way we are actually observing their faces, the way they shave, their general appearance as such, including their erratic behavior, because their behavior are manifestations of what they are thinking. You see, Behaviors are actions that we see. When a patient acts in front of us, there are so many mannerisms that we can observe. We have to record that because these mannerisms, these actions are all manifestations of what they think. The way they speak also, we have to consider that because you see, speech is a part of behavior. These are the things that will be observable. You see, speech can be manifested, can be a manifestation of what the patient thinks. Thoughts, mode are emotions and affect. No, the ability to perform abstract reasoning. Sometimes we have to ask problems so that the patient will answer that. And then memory, intelligence, concentration, orientation, judgment, and insights. These are all accompanied in our MMSE because we utilize in the hospital. We are very busy, so we are going to use a mini version of the mental status as an examination. There is what we call as mini mental status examination. So we will be utilizing that. Hopefully, it will be incorporated in our system. And we just stick it, no? Sometimes, gone are the days when I was studying, we record everything, but this time we just stick, no? It's a checklist, especially in the admission. So the most that we're concerned with will be more on the medical problem, that is on the physiological alteration and biological alterations. Sometimes, other than if this is manifested, if they are manifesting some sort of mental health problems, that will be the time that we are going to conduct mental status assessment or examination. But in other occasions, we don't do that. That will be our main concern. So we have to include that, whether we like it or not. Even though we are busy, we have to include this in our observation, in our note. Remember, we are actually placing our note, admission note, and this must all be included. You see? All right. Now, another one is that since we are nurses, we should learn how to do proper communication, how to use our communication, ourselves as a part of therapy for the patient. Because the moment that the patient is admitted already, we are starting our nursing intervention. The way we deal with them, we call it therapeutic relationship. Now, the way we communicate with them, it's called therapeutic communication. How do we communicate? It's not only verbal. We are going to look also into non-verbal communication. We smile, you see, even though even though the situation is actually let's say tense, we can always smile. In that way, the patient will actually be welcome. They feel welcome and they feel it's okay to be sick. And most of the time, we are actually letting the patient down because the patient feel instead of being relieved, being alone. That is actually the problem, no? Therapeutic communication is the essence of the helping relationship, our relationship with them. Because we embark in a therapeutic relationship as a nurse, that's our job. It will occur when the nurse communicate with the patient in a manner that will facilitate the acquisition of information initially because we have to ask about the understanding of the patient's concern and problems. That's why initially when I talk to the patient, when I'm still practicing in the hospital, or when I teach our students, I'm not using any chart. I'm not using anything on my hand. You know why? Because I do not just actually go in front of the patient to just get information. It's not like that. I will go in front of the patient because I would like to help the patient. I would like to establish my relationship with the patient. So I don't record. If you're going to observe nurses today, they just go in front of the patient and record everything. No more eye contact, no more therapeutic touch, no more therapeutic smile, no more therapeutic use of cells. Instead, we are very concerned about data, the information that we will gather from the patient. So this is the thing that we have to revive in our practice. Now, the therapeutic communication is an art of reaching a person by means of verbal and non-verbal messages, as I mentioned to you. If you touch them, of course, you have to be very careful about touching, no? In United Arab Emirates, there is limitation of everything, no? Especially for men like me. I cannot just even touch the patient. I have to be very careful about this. You know that. But in other culture, therapeutic touch is actually very necessary. If I cannot touch the patient, then I will just smile. I'll just let the patient feel at ease. You see? Acceptance also will be there. Respect, we will show respect. We will show honesty. We will show trust. Because the most difficult part of getting information from the patient will be establishing the initial part, where we establish our that the trust. We will establish the contract between you and the patient. If the patient will not trust you, they will not tell anything that will be useful to you. Or they may tell something by force, but they will not tell deeply or other things that may actually help you. Because how can they give information if they don't trust you? That's the thing. You are there also to offer your help, to offer your protection, to offer your support. You see? How do you feel that? How do you give that? The patient will actually feel it. The patient will actually belong to. Remember, the patient will be removed from a very important environment because he could be removed from the family, from the house, he could be removed from the job, and temporarily he will be residing in the hospital, which is very strange to them. So we would like to welcome them. That is the thing. We are there to help, and so on and so forth. Okay? So therapeutic communication allows the patient to share their emotions. They would like to feel accepted because they want something. The reason why they go to the hospital is because they need something from the hospital. They are the patient in one thing, so they need something, and this something will be given by us, the care that they are looking for, right? They look at problems from a new perspective. We do not we go there, the patient will go there, we'll meet them, and we try to explore the problem. Let them be involved with problem solving. After all, if you're going to look into the different theories of nursing, this is exactly what we have, no? If we are going to use Orem's self-care theory of nursing, eventually the patient will take care of themselves, so we have to assist them. We have to help them be involved with their care. That's what we want. That's what we like to be done to our patient. So we have to look into that. We have to consider that all the time. Now, other psychosocial skills that we will be needing will be acceptance. Remember, in therapeutic communication, it entails acceptance. What is the meaning of acceptance? What they know about it? You see, sometimes they feel so rejected, no? Because there are nurses who really cannot distinguish between the family problems and the problems that they have in the hospital. Human as we are, sometimes we bring the problem at home to the hospital, so we do not care about the patients anymore. Instead, we care about ourselves. Sometimes we are actually lost, so we do not even know how to smile. We are always complaining that we are tired. You see, so that's the thing. Now, the patient would like would you like acceptance? You would like to be accepted. They need something. They think that they can provide that. So therefore, we need to fill in the gap. That is the meaning of acceptance. It is the demonstration of an interest to the patient's behavior. We have to show our enthusiasm to give care. Sometimes when the patient actually calls, they are very demanding. They'll say, I am busy. It's reality, isn't it? I'm still taking care of another patient. Yet we do not stop and smile and tell that properly, right? So the nurses are always showing that they're very busy. Yeah, we are very busy. But people who are patients are also in need. They need someone to assure them. They need someone to accept them. You could always say, I know that you are here. I know that you are in need of something, but let me take care of the other person, then I'll come to you. You see? So that's the thing. They need a little bit of assurance and explanation. But sometimes nurses just leave. So the patients do not feel accepted. So that's why they curse the hospital. If you're going to look at how patients look at the hospital, it's something negative, isn't it? When they say hospital, it's just like a home for the sick. It's reality, it is. But we have to accept the fact that sometimes the patient needs acceptance. If we're going to change the way we look at the hospital, then it will really be a revolution in the nursing care, in the nursing service. Yeah. The nurses are very pleasant. Hospital is very pleasant. I like hospital. You see, I like that hospital and something else. Now you can demonstrate acceptance of the patient by listening to him. They would like to tell something. Even they disagree. You do not just actually disagree with them. You do not just reject with them. Just accept. Huh. After all, that's their opinion. You cannot debate. No, you do not need to criticize. No. Now remember, acceptance will reinforce the self-esteem. Remember, this is the thing that we would like to remember this. Last time we talked about Abraham Maslow, and the self-esteem actually belongs to the fourth level. That means to say, when they come to the hospital, there is already a problem in the first level that needs to be supplied. If that will be supplied, then they go on the feeling of security and belonging, and is after that, it will reinforce their self-acceptance. The moment that we increase the self-esteem, then the patient may take care of themselves. So, meeting the needs that's required in Orem's theory of self-care. That is the thing. Moving forward, can you see my slide? I'll try this because sometimes my other students cannot see. No? Yeah. So the other one is reassurance. How, when was the time you sat down with the patient and holds the hand? Just not communicating, but holding the hands. See? At least for 5 minutes. The moment you do that, it feels so good for the patient. It will it will actually provide a feeling of support for the patient because you're there to give your attention. You see? I do not like to see the hospital that is actually showing that all the nurses are very busy. Nurses are running. You see? Hospital supposed to be is going to be very quiet. And no point in time that the nurse will complain because we selected the job. We have to give care to the patient by all means. We have to provide every single minute if the patient requires support, physical support and psychosocial support. How do we do that? By giving reassurance. You see, the patient must feel that we are there whenever they need us. Whenever they are in the process of life and death, we are there to revive them, to help them. See? So they provide support. We provide support by giving our attention to matters that are very important to the patient. Remember, what could be important to the patient may not be important to us, but we are not the patient. We are nurses, so we have to understand the patient. We have to understand that their needs are different. So that's the thing. So we have to reinforce their emotional security so that we will improve and we will reduce their anxiety. No? The moment we are going to remove them from their family members, their anxiety will go to the roof, very high. It will actually turn immediately to severe. That's the thing. So we will be there to reassure them that they will be okay, even though without telling them. Our presence alone will be very helpful. Our holding their hands will be very helpful. You're very lucky, you're a woman, and you can actually hold the hands of man and woman, you know? So that's actually the most therapeutic thing that you can do without saying anything, isn't it? So when you're going to do that, the patient will feel at ease, the patient will smile. So that's the thing, rubbing the back, rubbing the hand. That will be one thing. In that case, we can reassure the patient. With less anxiety, take note of this, the patient can spend more time to effective problem solving and healing. So this is very essential and this is very important. Next, psychosocial skill, enhancing self-esteem. The moment that the patient actually has this increased self-esteem, they will be okay. they will be moving mountains. See, this is the thing that we would like to. They feel good. The moment that they enter the hospital, take note, the self-esteem will go down. Anxiety will go to the roof, and self-esteem will go down. Now, our job is actually to reduce anxiety and to boost the self-esteem. Increased self-esteem gives the patient a sense of control and hope. Remember, they are losing control of their life. They are losing control of their health. We need to reassure them. We need to provide them an avenue to know that they are in control of their health just by giving the medication alone. Say, we are taught that we are going to give the medication in front of the patient, especially the tablets, the capsules that you think. We empower the patient to do that, isn't it? Of course, it's different when you're going to deal with patients who are in the mental hospital, no? In the psychiatric ward, because psychiatric ward sometimes we have to make it sure that the patient are taking really the medication. But in a normal ward, like in the medical ward or in surgical ward, we can always say, you take this medication at 6 o'clock. Of course, you will be there at 6 o'clock, and you are actually going to remind that's your job. So the pills you empower to do that. All right, the choices when it's already going to be the time to sleep, the time to play. So you have to empower them to do that. This will help them to reduce their anxiety, all right, among others. Now, the techniques to reinforce positive self-esteem will include focusing on patients' positive traits. We have to look into that. If they're very cheerful, we have to utilize that. Now, if they would like to give stories, we have to listen to their stories. You provide opportunities for the patient to demonstrate their skills. Particularly, as I mentioned to you earlier, simple skill, simple tasks like making the bed, like going to the toilet, like taking the medications. This will always enhance the self-skill of our patient, the self-esteem of our patient. No? And at the end of the day, they will be reassured that they can do these things at home when they go at home. That is one of our jobs, enhancing self-esteem. Expression of feelings. This is one of our responsibility. Now, you see, the patient will be separated from their family members. Usually, the family members' visitation time would be limited only, and they will be in the hospital for quite some time. With whom they're going to communicate with, especially if they are in a private room. You see, how would they express their fear? How would they express their anger? We have to talk to them. We have to provide them environment in which patient can feel safe and comfortable to express emotions. We can actually allow them to do some sort of drawing, some sort of art activity or any other activity what we think will help the patient. We do not just allow the patient to sleep the whole day on their beds. That's why in the hospital, in our ward, there must be some area where the patient can relax, where the patient can sit down. Because it's not too easy to stay on the bed all the time, you know. They can sit down also, not on the bed, but somewhere else they can interact with the other people. No, so we'll find a way, no, to help the patients express themselves. No, we can actually have an activity room. This is not only true with psychiatric ward. This may be true also with the other hospitals. But if you're going to look at the hospital setup right now, the hospital addresses only on the physiological needs of the patient. We don't even see them. So sometimes they want to read, but they cannot read because they have nothing to read. They want to watch television, but there's no television. So that's the thing. And of course, during this time, the best way that we can actually do is to talk to them. We use the therapeutic use of our results in order to talk to your patients, no? So that you can allow the patient's expression of their feelings. We can always do that by employing therapeutic communication. Hmm? Moving forward, role modeling, you know? So the nurse can exhibit more socially acceptable ways of performing a certain role or demonstrating a certain behavior. Like smoking. How can you teach and role model smoking when you yourself smoke? How can you say you are not going to eat so much fatty foods because it's very dangerous to your health. But yet we are displaying that we are fat, we are obese. The patient may not believe that, right? We have to be very careful about this, no? So when the patient sees how effective these behaviors are, he or she can more easily understand how to use them and emulate the behaviors. We can actually teach things so that the patient may utilize them in any way. We role model things that the patient may actually copy, just like the proper use of time, the punctuality, your trust, the use of your word, the honor of your word when you're going to say, I'm going to visit you at 3 o'clock. Now, make it sure that you will be there at 3 o'clock because the patient will wait for you. It's role modeling because eventually when the patient will go out, when they say 3 o'clock, it's 3 o'clock, not 4 o'clock, not 5 o'clock. So that's how we actually do role modeling. Role playing is acting out the method of response to a situation. So we can always look into this when we are with our patient already. Now, it can be done to increase one's own or other understanding of the other's point of view, or to appropriate responses, such as assertiveness. Can you see my slide? Hello?
Yes, doctor.
You can see my slide.
Yes, yes, we can.
Oh, okay, okay. Because my other students
Sorry.
do not see, no? Okay. So this is done with a supportive person playing the part of someone you want to communicate with in a new way. So we can always actually do this and solicit the active participation of the patient whenever we talk to them, whenever we are going to conduct therapeutic communication. Remember, respect will always be the key. Trust will be another one. If you're going to gain respect, you will gain the trust. Then they are going to emulate you by all means. You role play. No? This is acting out of the things that you will do. Like for instance, no? When they go home, you may actually think of what they're going to do, what they are going to assume. All right? Along that line. Then stress management. That's another one. We should actually be equipped with this now. Accepting stress as a fact of life and managing it using specific or tested techniques can reduce the feelings of anxiety. We should know several techniques, no, of doing stress management, like listening to music, watching television. These are all coping mechanisms anyway. Then taking deep breaths or breathing exercise, walking. But sometimes hospitals do not allow patients to walk. This is usually the problem, no? There must be a way where the patient can exercise and do walking, right? Avoiding caffeine. Sometimes patient like caffeine, no matter what, no? So like me, no? As a nurse, I like caffeine a lot. I like coffee. A psychological intervention, psychosocial intervention, as counting 10, 1, and so on and so forth, no? Avoiding additional stressors. You have to determine that, no? And maintaining a positive attitude. How are you going to do that? Imagine in the morning, or say, hi, good morning. Good morning, Manera. How are you today? You see? Then you are there already. Good morning, Aisha. So you're very good. You feel so good. So the patient feels so good. Will feel so good also when you're going to greet them with your smile and so on and so forth. Then you are going to be there and spending time with your patient for at least 5 minutes, 10 minutes. See? And after the medication, you do not just actually go away. You just stay with your patient for quite some time and talk with your patients. Although you're very busy, but our job really is to make it sure that we care. We give the rightful care to the patient in a single day. We are not factory workers. We are human. We are working with human beings also. So we have to care for them. That's why in some hospitals, I do not agree with functional nursing. You see, every nurse is actually going to do a specific job. Like if you are a medication nurse, you just do only medication nursing. If you are just, or you just give medicine. If you are an IV nurse, you just give IV infusion to so many patients. So the holistic care is already absent. You cannot practice therapeutic management. You cannot practice therapeutic use of cells. You cannot practice stress management. You yourself is under stress because you keep on thinking about how many more patients you're going to give, or you're going to open the cannulation. You're going to give cannulation. It's difficult, no? All right. Then assertiveness. Assertiveness is actually following very good self-esteem. Assertiveness is the use of behavioral techniques that allow the individual to stand up for his or her rights without infringing on the rights of others. This is the ability of an individual to express. This is the ability of an individual to show his right, to know his right, and to practice his right without infringing on the right of other people. You see? So it's my right to go to the toilet. It's my right to know the medications I am receiving. It's my right to refuse the medication. So these are some of the things that you can actually revive in the belief of our patients. These are our key responsibilities in order to help our patients. And of course, there is the limitation of sitting. Limit setting is a form of behavior modification rather than a punishment and is used for times when acceptance of the patient's behavior is no longer appropriate. Like, for instance, we do not allow patients to go out. We do not allow patients to roam around. So that's the thing. They just stay in one place for a specific period of time. In psychiatry, we practice this. No? We just actually allow the patient to be confined in one place. De-escalation is another. What is the meaning? No, sometimes the emotion is too high, so you are there to pacify. That is the meaning of de-escalation. No, these are used to reduce anxiety and slow down the emotional response to it. So you're going to say, slow down, especially if they're excited. If they're panicking, also you say, slow down. Now, if they're very aggressive already, make it sure that you're going to slow down the patient. Useful techniques will include removing the patient from volatile situations. Whenever the patient actually quarrels with another patient, then you just remove the patient from the other side. You just move the patient to another room. That is the thing. Then using appropriate medication, of course, physical restraints. Appropriate medications like sedatives, physical restraints that, whether we like it or not, sometimes we separate the patient from the herd. Confrontation is another responsibilities that we should do. At times, it is necessary to make direct statements that challenge the patient's behavior or beliefs. Or going to tell, your behavior is no longer acceptable. You see, I'm not happy with your behavior anymore. I'm not happy. Why is it that you keep on refusing to sleep on time? You provide them explanation after that. Confrontation is a verbal message designed to help the other person recognize inconsistencies or inappropriate behavior. Sometimes we actually practice this with our children also, isn't it? That when there is something that we don't like from our children, we say, "Stop it! I don't like what you're doing." You explain. The patient, your children will stop, and your children will understand. Similar way with your patient, we do that. Empathy. This is our capacity to feel the feelings of the patient. How do we do that? We can communicate that we will understand, or we understand how our patients feel. Okay? So empathy differs from sympathy. Sympathy means we feel for the patient, but empathy means sharing the feeling of the patient. When the patient is suffering, we also know we should also tell the patient that we suffer with them. That is the thing. Okay? So that's empathy. Silence sometimes is the language that the patient may understand. No? This say nothing. Say sometimes saying nothing for a few minutes can communicate more than words. Disapproval, approval, all right, contentment. This can convey support, acceptance, and concern, and give the patient time to compose himself or herself. Sometimes talking will not be the right thing to do. Silence will do. Silence will help our patients in any way possible. And of course, at the end of the day, we will do relaxation techniques. Now, the nurse, how can we use relaxation techniques? The nurse can use a variety of techniques, including, as I mentioned, we can do this at least 5 minutes, 10 minutes. Breathe exercise, deep breathing, imagery. Sometimes we can actually bring some sort of music on the bed of the patient and we play. Then shading or maybe reading materials, also muscle relaxation and massage. You know, these are some of the things that we can actually do as nurses. No, remember, becoming a patient is different. They need something, so we have to do something as in return as nurses. All right. I mentioned already 13 techniques that can be very helpful to you. So we can also use complementary or alternative therapies. Now, complementary approaches are defined as those used in addition to conventional treatments. There are so many things that we can use. So many like acupressure, like massage, sometimes massage, like your debate, like in the case of using of oil, you know, the using of so many oils and other things. No, alternative ones are used in place of conventional therapies. So we can actually use this also in behalf of the patient. But of course, make it sure that when you're going to do this, the patient will be in the privacy of his room, like the use of specific I don't know how we call it now, a specific oil for treatment, no, for relaxations and so on and so forth. Many of these are used to treat emotional problems as anxiety and depression. Uh, yeah, we can actually use some oil, some sort of some sort of massage, the light, some sort of use of uh, let's say salt, so many things. No, uh, we can actually use this, but personally for me, I don't use. But on your part, you will actually use this based on your interest and in your training. If you believe that this can help your patient, then by all means, you could actually use these things. Alternative and complementary therapy. Like if you believe that a certain herb can treat a certain condition, why not? No, a certain concoction, why not? As long as this will not be in contradiction with the patients are actually with medical with our medical treatment and psychological treatment, we will explore all the things that we can do as nurses to help our patients as such. These are some of the complementary and alternative therapies that I have found. Acupressure, no? It's not necessary that you learn how to do acupressure, but sometimes it's the use of pressure in order to massage specific points in our body. Like for instance, if I feel so sleepy, I learn this. No, I massage in between my thumb and my index finger. When I feel nauseated, I massage between the bridge of my nose and my lips. No, I massage my head also, and I massage a specific point in my body. Acupuncture. Chinese medicine is actually using this a lot. They use needle, no, thin needles to designate points along meridians to balance the flow of energy. So special training will be needed. Acupressure, yes, no. If you know, but if you do not have a training, you can do that also. But for acupressure or acupuncture, you need special training because this is invasive. You know why invasive? Because you are going to insert needle. No, used to treat uncomfortable symptoms and some conditions. Alternative nutrition, as I was telling you a while ago, use of food to heal and maintain optimal health, like in the case of, let's say, supplements, macrobiotic diets, the diets that the patient may actually believe to be very helpful to him. All right? Aromatherapy, just like what I was telling you a while ago, it's a certain oil, then you burn it, then you actually release a fume, some very good fume, no? Then biofeedback, using electrical devices. You need to be trained to do this, but other neurologists are actually doing this, no? To record changes in body function to achieve relaxation and or muscle control. Most of the time we use EEG, electroencephalogram. No, the chelation therapy is another one. All right. We will be using man-made amino acids and so on and so forth. Chiropractic, the form of health care that focuses on relationship between body structure, primarily the spine and the function. No? So the massage or specific spine. If you're going to say chiropractor, that means to say they can fix any health issues using the spine. Then energy medicine, the use of energy fields as magnetic fields or biofields, no? Energy fields that some believe around and penetrate the human body. Most of paranormal psychologists are using this, and there are alternative doctors or medical practitioners who are using this. We'll be open, no? Then for remedies, alternative health practices and therapies based on health beliefs and practices within a cultural groups. Like if you have some mental disorder, you go and see the imam, and they will do specific, they'll do specific instruction, specific procedures to cast out the demon within us. That's the remedies. Guided imagery, we use this a lot in psychiatry, where we use conscious mind to create images with the help of music so that we can actually evoke physiological changes and promote healing and relaxation. We play music while the patient is actually asleep without closing their eyes. So we use the imagination of the patient. Then of course healing touch. No? The method based on the concept of human energy fields, we transfer our positive energy to the energy of the patient, no? Which otherwise would be negative. We will remove the negative energy that's coming from the patient. But in psychology, also therapeutic touch is actually very necessary. Just touching the patient, you transfer already the positive energy that you could actually have. Then herbal medicine, as I mentioned to you, the use of plants for healing purposes. Homeopathy, therapy based on concepts like cures like uses minute amounts of drug that normally would produce the same symptoms as the illness being treated. Now, then hypnotherapy, this is a special skill that we use in psychology. We create a state of heightened awareness in which suggestions to improve health are made and are likely to be followed when the patient will be put to sleep. If the patient is depressed, we use light therapy. Either we're going to allow the patient to go out and see the sunlight or to bombard the patient with high lumen light, no? High energy light, so that we are going to lighten the day. Remember this, the patient would actually be, if the patient is sad or lonely or depressed, they need light. Okay? So magnet therapy is another one. The use of electronic frequencies emitting from the body to treat illness. And of course, massage, no? Then the megavitamin therapy. There are so many doctors who are advocating the multi-doses of vitamin C. That means higher doses of vitamins that's usually recommended to prevent or cure illness. Let's say you may take around 1,000 or 2,000 milligrams of vitamin C. Of course, if you're going to do that, it's harmless. You know for a fact that vitamin C will just be released in our urine. Okay? This may be harmless, but if you're going to believe that megavitamin will actually be very helpful to treat your disease, then why not? So we will explore all these aspects of care. Meditation is another one. Ancient art of focusing one's attention on a single sound or image to promote relaxation and health. We use this a lot. Now, the moment that the patient will actually be agreeing to use meditation, that means to say they can concentrate. Remember, when the patient is in the hospital, they will be full of anxiety and afraid. So what happens is that they have difficulty meditating. They have the difficulty concentrating. The moment they are going to do this, then it will be very helpful already. That means to say the patient will be on the road to recovery. Then we have naturopathy, a system of healing that views disease as a manifestation of alternation in the process that interfere with the body's healing. There could be a problem with our body, so we have to do that. Reiki, it's another form of energy medicine where practitioners taught his or hands transmit life force energy. Well, I see, just like this. No? I read some books about Reiki already, but of course I don't know Reiki, right? Then yoga is just focusing your attention on your breathing technique. into one, just like taking in and taking out of oxygen and so on. This is a philosophy and exercise system that combines movement and positions to promote health. No, so most of the time, if we know this, then we know that we are actually helping our patients as such. So we could be very helpful. All right. Now, in conclusion, healthcare professionals need to incorporate assessment of complementary and alternative therapies in their care or their negative effects. One thing more, as nurses, it's necessary. It's necessary that we know some. That's why we are educating ourselves. We are trying to learn new techniques in order to help our patient. When we go to the hospital, we are not going to think about our own. Our life is not a life of what we call as individual professional growth. Our life must be devoted to the life of service. We do and serve. That's the thing. We go and serve. That's the thing. We will not think about ourselves, but we will think about the health of our patients. Now, the increased use of these herbal products reflect the public's risk for more control, incorporation, and sometimes the price. No, nurses as patient advocate, this is another job. Actually, one is nurse as caregiver, nurse as educator, then nurse as advocates. Need to be sensitive. We need always to speak in behalf of our patient, to be sensitive to these approaches and incorporate them in the plan of care whenever possible. Routine questions about use of herbs and supplements should be part of the routine nursing assessment. Now, it's actually very easy if to take care of our patient if we know how to take care of our patient holistically. Holistic care is the key. That's why we should be trained in terms of psychosocial care. We should be trained in terms of psychosocial understanding of the disease of our patients. Okay? Is there any question that you would like to ask within or outside the topic? Because Dr. Isnea is going to wait for you, is waiting for you already. So that's why we exchanged our timing today. Any question that you would like to clarify? Any wish that you would like to tell me so that I may address that the next meeting maybe? Or you just need to prepare for another class? Yeah? Is there anything that you would like to know more? Wapa? Shaika? Manera?
No, thank you, doctor. Everything clear.
Everything's clear. So next week we're going to start with the chapter 4. I hope that you're reading the book. Now we are still on that red book, okay? Psychosocial care. So we'll start with chapter 4 next
Doctor,
meeting. Yeah.
when you will send for us the assignment
By
subject?
by Monday.
Okay, doctor.
Yes.
Make
Okay.
it easy, doctor.
Yeah, don't worry. I know you are working people. No, so it will be easy. Don't worry. Okay?
Okay, thank you, doctor, for your time.
So if you have no questions, then we call it a day and have a good